And we've been joined by two additional individuals who make up the individuals that are associated with Harmony Healthcare Center. We've been joined by Ms. Crawford and Ms. Barton. And of course, Ms. Crawford and Ms. Barton, let me welcome the two of you to the show this morning, because we understand that both of you would like to deal with Harmony Healthcare Center, but at the same time, you've got some special information that you'd like to deliver to our audience this morning. And of course, you will give us an opportunity to receive that information, and Ms. Martin, you will follow us in reference to that.
Certainly.
Let's talk about some of the things that you'd like to talk about dealing with the status of health in Nashville, Ms. Crawford.
Well, I've come to offer a call to arms for Tennesseans, Nashvillians, and North Nashvillians in particular. The state of health is abysmal. We rank tops in obesity, diabetes, high blood pressure, all preventable diseases, or at least manageable diseases. And we need not be at a point where we think that these diseases and their side effects are inevitable. And parents need to realize that their health state will directly impact the health state of their children. Very related to nutrition and lifestyle. Most parents would make any sacrifice to ensure the safety and well-being of their children. Swim the longest river, go into a burning building to save their children. The things, though, that you need to do to protect your children from a very real danger, and that's poor health, is change a lifestyle. So eating habits, smoking, exercise. If you think about those diseases and how they impact pregnancy, if a woman smokes habitually, it's very difficult to stop smoking because you're pregnant. The better thing is to not smoke to begin with. If you smoke in the presence of a child, you're harming that child. So it's really, really important for parents to realize that before they can save themselves, they have to save their children.
Okay, very good. And of course, I think that, Ms. Martin, you've got some information dealing specifically with women. I think you've talked about parents and children, et cetera. But you've got, and I think that this is especially important when you think in terms of, I think women experience cardiovascular diseases more than we generally. Let's talk about women in healthcare.
Well, women generally are the ones that will make the choices for the family in terms of what kind of health care they get. So as women, as caring for women, we'd like to reach women long before they get to the point where they're pregnant, where we can optimize their health so that when they enter the pregnancy, they're going to be as healthy as they can possibly be. If they're coming into the pregnancy already obese, hypertensive, and with diabetes, those things are certainly going to strongly impact the pregnancy and the outcome of that pregnancy, and how they view it. If you come into pregnancy thinking that I am a sick person, then you have a tendency to give up all your rights as a person to whoever is supposedly managing your health. We would rather form a partnership with the woman so that she can work with us to get to the point where she is as healthy as she can possibly be, so that her attitude about herself is that I'm a perfectly healthy woman. I'm certainly capable of having natural childbirth without the drugs and the epidurals and the things that can certainly affect the outcome of the pregnancy. So that it's her attitude about herself and how she feels about her health that's going to impact the choices that she makes during the pregnancy in terms of how she approaches the childbirth. Does she see it as something that is a normal phenomenon of life, or is this a 9-month disease that has to be cured surgically? We're heading toward over 50% cesarean rate in this country, and that's worrisome.
That's not a natural situation.
No, it is not. And people aren't considering that any kind of major surgery has long-term impacts on their health. In a future pregnancy, she's going to notice that she's much more uncomfortable. She has a lot more cramping. Maybe her placenta is not going to attach where it should because she has an internal scar on the uterus that can affect that. But women at this time in their lives need education. They need to be educated not in fancy breathing techniques or any kind of, well, technique type things for labor, but what has to happen is that they have an attitude of, this is a healthy situation and I need to enter it as such.
And Ms. Crawford, buying into some of the things that she said, what impact does this have on African American women? Because from what we understand, that African American women especially have some real problems in terms of health, AIDS, and a lot of other things. Speak to that.
Well, let's just kind of think about some of the statistics. The infant mortality rate in Nashville is 8.8 per 1,000 births overall for the entire population. The infant mortality rate for African Americans is 14 per 1,000.
14 over against 8 per 1,000.
Against 8, double.
And African Americans make up a minority of the population.
Right. We make up about 16% of the population in Tennessee and in Nashville. And you know, seemingly small decisions can have such a huge impact on health outcomes. For example, the decision to breastfeed or not to breastfeed. When women give up the beauty of breastfeeding, they've given up the ability to inoculate your child for a lifetime against all of the diseases that are prevalent among African Americans. For example, breastfed babies, as they grow into adulthood, are less likely to have diabetes, high blood pressure, obesity, heart attacks, strokes, cancer. It protects them during their childhood as well. So babies that are breastfed are less likely to have upper respiratory infection, gastrointestinal infection, better brain development.
Okay, Ms. Crawford and Ms. Barton, let us take our second commercial break, and then we'll have the two of you back with Dr. Robertson, and then we'll have an opportunity to sort of give all of this a round table discussion atmosphere. And of course, we'll be back with our audience following this very, very short commercial break. Ms. Crawford